Hi guys, it's your girl Ren, and for those who do not know me, I am a registered midwife in Jamaica, and today I'll be talking about Antenatal Clinic in Jamaica, otherwise known as Pregnant Mother Clinic or Baby Mama Clinic. So I work in the public system, right? Which means the health center, the clinic, right? So I'll be talking about what to expect for Antenatal Clinic in Jamaica, public sector, the public system, right? So first of all, where Antenatal Clinic is concerned, for mothers, they will attend the clinic that is closest to where they live. So they ought to be going to their nearest health center, right? So that is first and foremost. Second of all, when do you start Antenatal Clinic? So ideally, you're supposed to start clinic within 12 weeks of finding out that you're pregnant. So it's not 12 weeks after you find out that you're pregnant, but it's within 12 weeks, right? So you really shouldn't be pushing it and like popping up at the clinic to start clinic when you're like 6 months, 7 months, 8 months pregnant, right? We want you to start as early as possible. So where the antenatal schedule is concerned, you'll be coming to clinic every 4 weeks up to 28 weeks of pregnancy. And then you'll be coming to clinic every 2 weeks from 28 weeks of pregnancy to 36 weeks of pregnancy. When you reach a 36 weeks marker, you're going to be coming to clinic every week until you deliver, right? Bear in mind that during your antenatal clinic period, you will be sent for booking to the hospital that books for your parish, right? So I'm in Kingston and St. Andrew. So my hospital that my clients, my patients are sent for booking at is at the Victoria Jubilee Hospital. So for the first visit, that visit will be more lengthier than the other visits that you will do, because on the first visit, we, the midwives, will be doing a complete head-to-toe assessment, right? So basically, from the crown of your head to the sole of your feet, you will be assessed, right? So it means that if you having any dentures, if you have on a wig, the midwife is going to ask you to take off the wig so she can see everything, see your scalp, everything, right? We're going to look in the mouth, we're going to check everything, we're going to check breast, we're going to check the abdomen, we're going to check your genital area, right? We're going to check everything, your feet, everything. So be prepared for everything to be checked. Sometimes we have patients who, even though you tell them that everything will be checked, you know, you tell them to go behind the curtains, undress, take off everything. That same patient will turn and say, "Nurse, I must take off my bra and my panty too?" Yes, you will have to remove everything for us to check everything, right? All right. Also, we will be taking a detailed history. So like your family history. So if you have any family who have sugar, diabetes, hypertension, high blood pressure, heart disease, sickle cell, all of those, right? We'll be taking a detailed history to find out everything about your family, right? We'll also be taking a detailed history of your medical history, like say your past medical history. If you've had sugar, diabetes, high blood pressure, anything at all, right? We'll also be taking a history of like if you were pregnant before, your previous pregnancies, you know, your previous labor and delivery experience, how long you were in labor for. We're going to ask like the size of your past, your previous baby. So we'll probably ask like the weight of the baby, if that baby is still alive, everything, right? We're also going to be asking if you had any surgeries in the past, if you're making any accidents. So a detailed history will be taken, right? Because if we don't know your history, you know, we're not going to be able to manage you properly. So we need to know everything about you in order to manage you properly for this pregnancy, right? Also, we will be asking you beforehand to take in your vaccination cards, right? Your immunization cards. We'll be looking at it to find out if you need any booster shots for this pregnancy, right? So we're definitely going to need you to take in your immunization card, right? Also, if you were pregnant previously, you would have, once you went to a clinic, right, a public clinic, you would have had a maternal book. It's a small blue book. You would have had that book with like details of the pregnancy that you had before this pregnancy. We're going to use that book, right? So you have to take that book in as well for your current pregnancy, right? Also, for the first visit, we normally do the antenatal blood screen, right? For most clinics, they would normally have a book, we call it booking day. So like a new mother's booking day, which sometimes we just allow the new mothers to come on that day, right? For some clinics, they have a lab on site which they will send the clients to, like take off bloods to do the antenatal screening. For some health centers, we don't have a lab at the facility, so the phlebotomist will come in and take off bloods. For my health center, we don't have a lab on site, so the phlebotomist normally comes, right, and take off the bloods for the pregnant mothers. Okay. Also, on your first visit, you're normally given antenatal supplements. So once it's available, you will be getting your iron supplements and your folic acid supplements as well. You will also be given an ultrasound request form for you to do an ultrasound, right? So this is the sore point sometimes. You have persons who do not want to do an ultrasound, right? Because in their head, they believe that the ultrasound is done to find out what kind of baby they're having, if it's a boy or a girl. But the ultrasound is not done to find out the gender of your baby. So we're not trying to find out if it's a boy or a girl you're having. No, that's not the reason why we do ultrasounds. We ask for the ultrasound to be done because we want to find out about the pregnancy. So we want to find out the position of the placenta. We want to find out how many babies are in there. So we want to find out if it's one baby, two babies, three babies, or more babies, right? We want to find out if there's any abnormalities with the baby. We want to find out the estimated due date of the baby, right? Because you will notice that every month or every week when you come to antenatal clinic, the midwives normally measure your belly to find out if your abdomen is growing, right? So based on the due date from the ultrasound, we will match up back with what we measure to find out if your baby is actually growing, right? So let's say you're 32 weeks pregnant, right? But when we measure your belly when you come to clinic, we're realizing that we're just measuring, your belly measures only 20, right? So 20 centimeters your belly measure, but you're all the way up at 32 weeks pregnant. It would mean that that's cause for concern, right? Would mean that your baby is small for gestational age based on what the ultrasound said that you're supposed to be measuring, right? So there's a lot of things that the ultrasound is required for. So it's not about, you know, if it's a boy or a girl baby you're having. Also, ideally, you're supposed to do at least 3 ultrasounds during your pregnancy. Also, for your first clinic, you will be, and not just the first one, for all of the antenatal clinics, you'll be getting your parent craft teaching. So we will teach about the pregnancy, what to expect during pregnancy. We're going to teach about like danger signals in pregnancy, the minor disorders of pregnancy, and we're also going to be teaching you about labor and delivery. You know, what to take to hospital for delivery, how to breathe during delivery, what to expect for each stage of labor, all of that, right? So it's very important to be punctual for all your antenatal clinics, as a educational talk is normally given before the actual clinic starts. So before the physical assessment and all of that is done, we normally do a parent craft teaching. Also, how could I forget, for your first antenatal visit, not just the first antenatal visit, but for all the subsequent visits after that, you're going to be required to pass urine when you wake up to carry it to the clinic for testing, right? So remember, ladies, it's very important to start antenatal clinic early, right? So you start in your clinic ASAP. As soon as you find out that you're pregnant, you are going to start your antenatal clinic. Also remember the importance of doing your ultrasounds, right? We don't do ultrasound for finding out the gender of the baby. It's way more important than that, right? So remember, if you plan to get pregnant, or if you're in the course now of being pregnant, make sure you put away some money aside for your ultrasound, right? Because it's very important. And also remember, when coming to the antenatal clinic for the first time, try to just sit down and map out who in your family have what condition, who have high blood pressure, who have sugar, all of that, right? And just try to remember your details about your other pregnancies, about your other labor and delivery experience once you're not a first-time mother, right? All right, so we're at the end of another informative video, right? So if you have not subscribed to this channel as yet, please do so now, right? And make sure you turn on your notification bell so that you can know when I post another video. The other video that I'll be doing will be about maternity costs in Jamaica in the public sector, right? Because yeah, healthcare is free in Jamaica, but there are some things that you still have to pay for while you're pregnant, right? So that will be the next video coming up, right? So thank you for watching, guys. Peace out, and I'll see you in the next video.